Thanks everyone for joining. We're going to go ahead and get started. Today I'm just going to go through an overview of our different programs. We can do questions at the end. Like I said, I've been here over 19 years, but sometimes I still get stumped, so you never know. But generally I can answer most things, and if I can't, I can get back to you with the answer. So I want to start by just going over some basics, because some people just know that retirement means Social Security, but aren't really familiar with even how it go about making wages and getting their Social Security checks. You know, I remember when my first job, besides babysitting cash jobs, when I get my paycheck and I see those taxes coming out and I'm like, what the heck is this? Like, that's not fair. But FICA taxes or Social Security taxes, they can be listed several different ways on your W-2, maybe OASDI, which is Old Age Survivor Disability Insurance. That is the many different ways they'll be reflected. And when you are working and paying those Social Security taxes, you're funding the Social Security program for current beneficiaries, as well as going toward your future benefit. So the way the FICA taxes work when you're working for an employer is that you're paying half and your employer is paying half. Now, Social Security does cap off at a time, depending on how much you make. There's a max taxable. Medicare will always continue to come out no matter how much you make. So about 94% of workers pay into Social Security. Now in Illinois, we are in a little bit of a unique situation. Our state has a lot of people that do not pay into Social Security. So our public school teachers, state universities, City of Chicago employees, there's a large group of people that do not pay in. But nationally, about 94% of workers are paying in. Oop. Okay. So the first program we're going to talk about is disability. So many times when people are thinking about Social Security, they're only thinking about the retirement part of it, but we do have disability that's there should someone become unable to work prior to retirement. So anyone prior to full retirement age can apply for Social Security disability. Anyone under 65 can apply for the disability based on our needs-based program we're going to talk about. But the definition of disability for an adult is the same for both of our programs. So that's a person who cannot perform substantial gainful employment because they have a severe condition or combination of conditions that's preventing that. And it's a long-term condition that's going to last at least a year, or is expected to result in death, so like a terminal illness. So someone does not have to be off work already for a year to apply for disability. It's just like if someone breaks their arm and they're going to be off for 4 weeks, that's not what we do. We don't have short-term disability. It's a long-term disability program. Now, when they're making that medical decision at our disability determination service that we send for the medical decisions, they're looking at, can a person do past work or another type of work and do substantial employment? So Social Security disability is the one we're working and paying into. Those FICA taxes that you're working and paying into, they're not only going for your retirement, but should you become unable to work prior to retirement, you could look at that Social Security disability. Then another program, Supplemental Security Income, we call that SSI for short. That is a federal program. It's needs-based. Comes from a completely different fund. It comes from a general tax fund. So it does not come out of the OASDI fund. And this is for both children and adults with disabling conditions, or anyone over age 65 that meets our income and resource guidelines. That's called an aged benefit. Now you'll see our website on the bottom of every slide because we don't want you to forget it, ssa.gov. If you do use internet, it's always a great way to learn more about our programs. There's way more information than I could cover in a presentation online, something for literally everyone. We even have educator section with lesson plans for teachers about Social Security on it. So anything you can think of is available there. So just to break down the differences between the two programs, because we have a lot of people that get very confused over even what their own benefit is when they're receiving from us. And some people can receive from both of these programs if their Social Security is a lower amount. So again, Social Security is coming from that Social Security trust fund, whereas SSI is coming from a different general treasury fund. Social Security, you need to have worked and paid into it. You have to have, in most times, enough recent work and enough overall work. The older you get, the more work you need to get the Social Security disability. Whereas SSI, you don't have to have any work history. It is completely needs-based, but you have to have very limited income and resources. Social Security disability, you can have $100,000 in the bank and still apply for your Social Security disability, because that's based on what you worked and paid into the system. And then with Social Security disability, you might have benefits that, we'll talk about it more in the retirement section, but your spouse or children might be eligible for on your record. Whereas SSI, it's just paid to the child or the adult with the disabling condition. But then next, what we're moving on to is what most people think of when they think Social Security, and that's our retirement program. So even before I started working for Social Security, I didn't know anything about disability, Social Security disability. I knew about retirement. I knew about survivors because one of my friends received a monthly check when I was younger from that program, but I didn't know the details. So we talked about how you're paying into those Social Security FICA taxes. That's how you're earning your credits toward your future retirement. It's also how you earn credits toward your Social Security disability. But with retirement, it does not matter when you earn them. So Social Security disability, you have to have enough recent work and overall work. Retirement, you just need enough overall work. So you just have to get to 40 credits. And so a lot of us are going to have that within 10 years of work. So like I said, I started working when I was 15, and actually a little bit of detasseling before then, but more when I was 15. And when I was 26 or so, I got my paper statement in the mail, and I had my 40 credits for retirement, because it just takes 10 years of work if you make the 4 credits a year that you can make. This year, you only need to make $1,730 in earnings to give you 1 credit. Now, once you hit the 40 for retirement, we'll provide you a retirement estimate in your online account that we're going to talk about, because that means we know you have enough to get retirement. But of course, when I got that estimate of benefits when I was 26, it was not very high, because I had been working mostly part-time jobs until the 4 years that I'd been working for Social Security or so. And when we're getting your Social Security retirement benefit, the first thing they do, and the computer does this, I'm not sitting there with paper and pen, so you don't have to worry about me messing it up. We're going to adjust your wages for inflation. And then you see step 2, find the monthly average of your 35 highest years of earnings. So some people say, well, I can't stop working at 55 because Social Security looks at the most recent 5 or the most recent 10, but it's actually the 35 highest. If you don't have 35 years, there's just some 0 years in the computation for you. If you continue to work after drawing Social Security, we always use the high 35. So every fall, the computer will do a run to make sure we're using the correct years. So like I said, we get the average index on monthly earnings. We apply a formula to that. So if you're a math person, you can go on the website and you can go and index all your earnings, and you can do these computations yourself. If you're like me, you can just log into the online account we're going to talk about and say, oh, look, that looks nice. Nice and easy. So one of the things we get called a lot about is, when should I start my benefit? So we can tell you what your money's going to be, but we can't tell you what to do. You have to be the one to make the decision as to when you're going to draw your benefit. So you see, we have an example here where someone's full retirement age is 67. That's going to be a lot of people's full retirement age, but we'll talk about that more in a moment. So if this person whose full retirement age is 67 drew at 62, they're going to get $1,400 a month. Now, it's going to go up every single month. So at 62 in 1 month, it's going to be a little bit higher than $1,400. So it's not just the yearly jumps. Every single month you wait, it's going to keep going up. So 67, that full retirement age, that's when we consider you're getting your unreduced benefit. So that's your full retirement, unreduced benefit, and you don't have any earnings restrictions or anything at that point. So a lot of people might wait till that benchmark. But some people might wait till 65 because that's when Medicare starts and they need to keep working for health insurance, but overall they're just ready to retire. Or other people might say, I don't need this money right now, and they will keep waiting even past full retirement age. Age 70 is where it maxes out. So between full retirement age and age 70, you get delayed retirement credits. Those are going to average about 8% per year. But I can tell you, don't wait past 70. You can't go before 62 for retirement, and you do not want to wait past 70. I talked to a woman earlier who's going to keep working until she's 72, so I reminded her, when you're 70, make sure you get those Social Security checks started so you're not losing out on your money. So here's the chart where you could find your full retirement age. So it's been going up, and if I'm perfectly honest, I'll be glad when we're done with this chart and I can just tell you your full retirement age is 67. That'll make my job easier, but it's not too hard. I just count backwards when someone gives me their birth year by 2 months. So we're kind of in that in-between time right now with people coming in who might be 66 and 8 months, 66 and 10 months. But for myself, everyone born 1960 or later, our full retirement age is 67. So if I take it at 62, I'm going to have a 30% reduction. So some people might say, well, that's too much. I don't want to take that reduction, because they'll go back and think, look at that. That person would have got over $1,000 more a month between 62 and 70. But the other thing is that person at 62 got 8 years of benefit checks while that other person was waiting. So some things you want to think about when doing this is maybe longevity in your family, your own personal health histories, what your financial situation is. So for myself, I don't have anybody that can go on my record. I'm not married, I'm not having children, I'm going to keep it that way. So no one's going to get my money. So maybe I'll say, well, if I take it at 62, then I can put that in an account, and if I don't spend it all, my nieces and nephews can have it when I pass away, right? So everyone's got a different idea of things, and everyone's got a different budget. So your idea of when you should do it might be different than your spouse or your neighbor or your sibling or your best friend, whoever that might be. You have to kind of do all the numbers for yourself and see what makes the most sense. Now, one big factor in if you file early, though, is if you're still working. Because we do have this earnings limit, and this year, we're in 2024, so everything we talk about, if you're watching this recording later, is 2024's figures. And if we have cost of living increases, these generally all go up. So you can go to, guess where you can go to see the recent figures? SSA.gov. Yep. So once we release the cost of living and you turn on the news in the morning and you see, oh, cost of living increase, all the figures will get updated on this nice little fact sheet on our website. So you'll know what's the earnings limit for next year in 2025. So this year, $22,320 if you're under the calendar year in which you hit your full retirement age. So if you are working and making $102,000, you're probably not going to file yet, maybe, because you're $80,000 over the earnings limit. We're going to hold $40,000 worth of benefit checks if you file. So you might not get any. So you might say, well, I'm going to wait. But if you are making $30,000 this year, you might say, well, I'm going to go for it. So you're, let's say, $8,000 over the earnings limit. We're going to look at half of that because we hold $1 for every 2. So we need to hold $4,000 in benefit checks. And if you're getting $2,000 a month, we're going to hold 2 checks. So the way that works is, let's say you started your benefits with June. They're paid in July because all Social Security runs a month behind. So we'll hold July, June paid in July, July paid in August, and you'll get the rest of the checks for the year, is how that would work. And then we'll recalculate your benefits at full retirement age, basically making it like you would have taken it 2 months later, so giving you a higher amount at that time. Oops, sorry. And then the year you turn your full retirement age, same basic premise, but you can see quite a higher earnings limit. So $59,520, we hold $1 for every 3. But let's say those scenarios we're talking about, you're working all year. Let's say you're like sitting there next year and you're in Illinois and you're like, I might as well work in January, right? Nothing going on here that's that pleasant to do. But spring rolls around and you're like, you know what, May's looking good for retirement. And maybe you made a bunch of money January through April. Let's say you somehow get a really nice job, you made $100,000 in 4 months. Send me the location when you retire so I can see if I'm eligible for it, right? But that case, it does not matter how much you make up until your retirement if you're going to stop or reduce your work. Because the other thing we can look at in the year you retire, that's the yearly limit, the monthly limit, which is this the yearly divided by 12. So this year it's $1,860 a month. So if you stop working in April, we do not care what you made January through April if you're going to be under that $1,860 for every single month for the rest of the year. So that allows people to go ahead and get their Social Security, at some point in the year, even if they've been working full-time up until then. So the earnings limits apply until the first day of the month in which you hit your full retirement age. Then you can work and make as much as you want and still collect all your benefits. Now, whenever you file for benefits, there's several questions we're going to ask you. So we're going to say, whether you file online or whether you do an interview with us, questions are the same. So you won't miss these by filing online. You're still going to be prompted for these answers. Do you have any children that are under 18, still in high school up until 19? So a lot of people, kids in their senior year, hit their 18th birthday, they can get that check till the end of the school year. Or that last category is something really paying attention to. 18 or older and having a disability prior to age 22. So your adult child might be 40 years old by the time you draw your retirement benefit from us. If they've had a disabling condition since before age 22, and they're not currently married, they've not been able to work really substantially on their own record, they can be eligible for something called disabled adult child benefits off the parent's record. Whether the parent's filing for retirement, disability, or a parent passes away, this is a benefit eligible for. But sometimes by the time you get into this question, you're not really thinking about it. So if you have that adult child with disabling conditions, make sure you list them down. We'll go through the application, we'll send it for a medical decision, and then we'll determine if they're going to be eligible for them. But at least you looked into it so we can make sure we're not losing eligibility for anyone. The other thing about disabled adult child benefits is they get Medicare after 2 years on your record. Okay, first category we're going to talk about is somebody who's currently married, so benefits off a current spouse. First things first, to get off a current spouse, both of you either have to be filing or receiving a benefit. So you cannot draw off a current spouse if they are not receiving yet. So what we're going to do then is we have this rule that's called deemed filing. Before you can get anything off a spouse, if you have 40 credits on your own record, you have to take your own first. So you can't just take the spouse's anymore. So what we're going to do is we're going to say, what is your own full retirement age benefit? Even if you're filing at 62, what's that full retirement age rate? And if your spouse is receiving or filing, what's 50% of their full retirement age rate? If 100% of your own is more than 50% of your spouse's, there is no spousal benefit payable, okay? You're just going to get off your own. But if it's less, we're going to pay you what we can on your own, and then the difference between 100% of yours and 50% of your spouse's on their record. So let's say your spouse's benefit is $2,000 a month, their own benefit. So half of that is $1,000. Your benefit is $600 a month. If you're at your full retirement age, we'll pay you $600 on yours, $400 on your spouse's to get you that total of $1,000. But if you're not your full retirement age, you're going to have it reduced on those records. Now, generally, you need to be 62 to get a spousal benefit, but there is an exception for people who are caring for a child who is under 16 or disabled. So in that case, you don't have to be 62 yet. The one thing you want to keep in mind is spouses, children, survivors that we're going to talk about, they all have that same earnings limit we talked about, too. So a younger spouse, they might be eligible, but again, making money if they're working to be over that limit. Then divorced spouse benefits, a lot of similarities with this in that we're going to look at your own before looking off a former spouse. A marriage has to have lasted at least 10 years, and you cannot be currently remarried to someone else to draw off a divorced spouse. Have to be age 62 years of age or older. Here is the big difference with divorced spouse benefits. Your ex-spouse does not have to be drawing yet for you to be eligible for divorced spouse benefits. So your current spouse does, your ex-spouse does not. So tell them they can't just sit around not drawing to keep you from getting their check, right? So they just have to be eligible. They have to have 40 credits, they have to be at least 62, or they could be receiving a disability benefit. So this is just an entitlement. This does not no benefits ever reduce the worker that we're paying. It also is an independent benefit, so a current spouse and children can get the benefit as well as a divorced spouse. So it's not pushing anyone away from eligibility on that record. Oops, what do I keep hitting here? Oh, there we go. All right, last category of money benefits we're going to talk about is survivor's benefits. So the rules of eligibility for children are the same that we talked about, but for surviving spouses, surviving divorced spouses, they are different than regular spousal benefits off someone who's living. So these benefits for survivors can begin as early as age 60 or as early as 50 if having a disability, or again, any age of caring for that child under 16 or disabled child of the worker. Then you can also see you can remarry after age 60 and keep your eligibility to survivor's benefits. So that is one thing to look into. Just because you're remarried, if it happened after age 60, you can still check off that former spouse. And if you're worried we're going to miss these two, again, we're going to have you list all these marriages down so we can check those records before we process your claim to make sure you're making the best decision. So another difference on survivors is how much you can receive. So the max you can receive off someone who's living is 50%. Survivor's benefits start at 71.5% of the worker's benefit and go up to 100% of the benefit at full retirement age. So you can receive more. So there are a lot of situations where you might not be eligible for spouse's benefits. With a lot of people having both members of a couple in the workforce now, spouse benefits aren't quite as common as they used to be. But if the higher earner of the couple passes away first, that is when you could get the survivor's benefit. So those survivor's benefits are something you would want to contact us about, because if you're not on their record, you need to file a separate application when they pass away for those. So again, the difference is 62 versus 60 or 50, 50% or less off a current, somebody who's living, 71.5 to 100% off someone who's passed away. And remember how I talked about with spouse's benefits that you cannot just take the spouse's benefit and let your own, sit there? Well, survivor's benefits are an exception to that rule. So you have more filing strategies available with survivor's benefits. So what you can do is you can take your survivor's benefit as early as 60, let your own keep growing. And you could switch it as early as 62 if yours is higher, but you don't have to. You can say, I want to let mine keep growing. I can make ends meet just fine on the survivor benefit. Max yours out till age 70. You might be surprised that it does grow higher than the survivor's benefit. You might think, well, mine is never going to get higher, but at age 70, you'd be surprised what those delayed retirement credits add up to. So it's something, you usually even send a letter to survivors who are coming up on 70 to say, hey, make sure you're checking on your own, make sure you're getting the most you can get. Another strategy you could do is leave the survivors sit, take your own at 62, switch to the survivors at full retirement age. Survivors benefits do not earn delayed retirement credits, so you don't want to wait past full retirement age to take those. So another benefit we have, you might have seen I've seen some Sunday morning life insurance commercials that kind of make fun of our lump sum death payment, also known burial payment. Like, you can't get by with funeral with what Social Security is giving you. I agree. It's $255. But it is something that is payable to a surviving spouse or a minor child or disabled child on the record. We do not pay it out to like an estate or otherwise an adult child not on the record. And then something that's very uncommon is parents' benefits. So not a lot of people know about these. This would be if an adult child was providing at least half financial support to their parent who is 62 years of age or older, and that adult child passes away first, the parent might be eligible for benefits off the adult child's record. So now we're going to switch gears a little bit toward Medicare with a preface that all we do is enrollment in Part A and Part B at Social Security. And then if you want to get in the nitty-gritty of any of these other things, you're going to go see Sue across the hall or next door. So Part A, your hospital insurance, that is when you're inpatient in the hospital. So you have to be overnight or longer. It does not pay for like even ER. You have to be inpatient admitted for that. But if you have 40 credits off your own record or a spouse or former spouse, you're not paying anything monthly for that. So there's some people that have to pay monthly for it, but it's not very common. Part B, your medical insurance, everybody has a base premium of $174.70 a month this year. Some people pay more. Onto that, you can add prescription drug insurance. I can tell you that came around about 20-ish years ago because that's why I got hired. I was a Part D hire, they called them. So that's been around for a while, but again, Social Security doesn't do that. We just have something called extra help that can help people with limited income pay for the monthly premiums and the co-pays of that if they meet our guidelines. Then you can add supplements. Then increasingly popular is Medicare Advantage plans, also known as Part C. That is when you're still going to enroll with us in your A and your B, but then you're going to get in that Medicare Advantage plan and they're going to take over all the billing, everything, coverage, everything else. You're going to deal with that plan. Some people like these because they usually have the Part D plan just kind of figured out for you alongside of it. And they might have vision, hearing, dental, things traditional Medicare doesn't cover as well. And it can lead to lower out-of-pocket costs. So, of course, the big time everyone's thinking about Medicare is age 65. That's the earliest you can get it based on age. But we do have, if you're on Social Security disability or that child disability, disabled adult child benefit, you can get Medicare after 24 months. If you have ALS, there is no longer that 24-month waiting period. You get Medicare immediately upon being entitled to disability. And then we do have specific policies for kidney failure. It's also called end-stage renal disease. For people going through dialysis, kidney transplant, things like that, they could even still be working and qualify for this type of Medicare. It's a very specific policy on that. This is your enrollment periods for age 65. So the first opportunity is your initial enrollment period. 3 months before you're 65, the month of, and the 3 months after. If you are already receiving a Social Security benefit from yourself or a spouse, you will automatically be enrolled in Medicare A and B. The card comes about 4 months before your birthday. It comes in a pretty white envelope with a teeny little bird in the corner. And a good chunk of people, rightfully so, maybe throw it away. Because you're getting a lot of junk mail. Everyone in the world has found out you're turning 65, right? Everyone wants you to sign up for their stuff. And you're just like, not another one, you know? Into the circular file. Now, the good thing is your Social Security number is no longer on those Medicare cards. It's a combination of letters and numbers. So if someone fishes it out of your trash, you'll be okay. But you're probably thinking, I never got my Medicare card. And we did send it. As long as we have your correct address, it got to you probably. It's just, it happens. So be on the lookout for that if you're already receiving benefits. Open all the mail, and then you can still throw all the other stuff away, but just make sure you can find that Medicare card. But if you are not on Social Security benefits and you need Medicare at 65, there is nothing magical that happens to put you into Medicare. You actually have to tell us you want it, okay? So you can file, if you're like, I don't want my checks yet, but I need this Medicare. Maybe you're self-employed, something like that. You need the Medicare, okay? So you want to sign up. If you want it the first day of the month in which you're 65, you need to do it the 3 months before your birthday. If you wait till the month of or the 3 months after, it's going to start the month after enrollment, okay? Now, when you get all that junk mail and you're opening it, to make sure you understand everything carefully, you're going to see a bunch of things that threaten penalties if you do not get into Medicare right away. That may or may not be the situation for you, okay? Because if you are still working and covered under group health insurance based on your employment, so the two things you have to have is current work, not retiree insurance, and group health plan through your employer, then you likely do not need to get into Medicare. Now, some employers are eager to dump you at 65, so you always want to double check with your benefit specialist, but the majority of employers will let you continue their group health insurance while you're working. So if that's the situation, you can wait on Medicare. Now, if you're enrolled in benefits already, you're going to have the Part A no matter what you do, but you can refuse the Part B. If you're not enrolled in benefits, you can apply for the Part A if you want, but you don't have to. You can leave them both until you're ready to get your Medicare. Because that's the case where you're going to have special enrollment periods. So it's not only you, if you have a spouse covering you and they're still working, and what else? In addition to employment, what else do they need? Group health plan, yes. Somebody's listening, yes. So those two things, very important. Because some people come in your office and say, I had the marketplace, I had the VA, I had TRICARE. None of those cut it for special enrollment period. It has to be that group health plan. So this is really important. Or retiree insurance, still not cutting it. Has to be that active employment. So if you or your spouse are covered, that's okay. You can have that special enrollment period. When you're ready, when you're however old you are, when you stop working, you just they'll fill out a form that says, yes, we've been covering her under our employer group health or him under our employer group health since age 65. So if not though, that last box, you are not going to have to worry about it because you came to my class, okay? And you know what you need to do, right? But if you missed the class and you thought, well, I have this, I don't ever get sick. I'm not paying $174 a month for something I'm not going to use. What I like to say is you can't call State Farm and get property insurance after your house catches fire, right? So if you have a bunch of health plans or health problems start right now in August and you did not get in and you don't have a special enrollment period, you did not get in under your initial enrollment period, you have to wait till January to get the Part B especially. We cannot put you in just because things have unfortunately come up in your life. So that's why this is so important to make sure you're researching it before age 65. General enrollment period is January through March. One nice thing that did change about that is you used to have to wait till July for the coverage to begin. Now it starts the month after enrollment. So you come to us in January, it starts in February. But you do have a 10% penalty onto your monthly premium for every year you didn't take the coverage, and that is for your lifetime. So I've had a gentleman came in at 85 to get Part B. So 200% penalty onto his monthly premium. So there's no max out. It keeps going the longer you wait. So again, just do your research and you will be okay. It's nothing to get stressed about. Just don't wait until the day of your birthday to start looking into it. Yes?
Okay, so even if you were covered by an employer over 65 and you decide to take this at 70, then you're going to take that penalty?
Well, not if you're covered by employer and what? And what else? A group health plan, but what else by the employer? Currently working. Currently working. So it cannot be your retiree plan. So currently working, group health plan, you don't have to worry about that general enrollment period. This is for somebody, like I said, if they're under a retiree insurance, misunderstood, went past the initial enrollment period, then they have to wait till the next general enrollment period. If it's less than 12 months, there would be no penalty. So if you figure it out in the first year, and get in the next general enrollment period, you won't have a penalty, but you do have to wait till January. If it's more than 12 months since you turned 65, you're going to have penalties.
Even if you're working on
No. This one you can get in anytime. Anytime when the employment ends. You don't have to wait till the January for that date. If you stop working this month, you can contact us and get your Part B started next month. Okay. Mm-hmm.
The one, so the enrollment, the one they show on TV between like October and December.
Good question.
Okay. What is that
So that's for Medicare prescription drugs. Medicare prescription drugs are Part D, Medicare Advantage plans. They have different enrollment periods. So again, that's something, okay. Easiest thing to remember, SHIP, S-H-I-P, like a boat. SHIP counselors, go talk to them. Why I can tell you to talk to them is they're not going to charge you and they're not going to sell you a specific plan, but they can help you with all those questions. So most senior centers have them. You can look up on the Illinois Department of Aging website and find out what's closest to you. But they are wonderful. They help with not just that, but they help with like appeals, all kinds of things. So, yep, Good Shepherd has SHIP counselors. So yes, that's who you would direct those questions to, and they will take care of you. So one thing I wanted to point out is we're going to reaffirm when you need to get in. Initial enrollment period, 3 months before, starts right away at 65. In the month of or 3 months after, first day after sign up. Again, initial enrollment period, first day after the month of sign up. That's not too hard. Special enrollment period. Of course, we got to throw a little more at you. So if you sign up while you're still working or the following month, you can say, it's today, where are we, August 14th today? You can say, I want it back to August 1st, or you can pick any of the following 3 months. The special enrollment period is 8 months total. If you come in any of the other 7 months, we can't backdate it for you. You can't pick the month. It's going to be the first day of the month after you sign up. I've had a few people stop by my table to ask about this today. So we call this IRMA, or Income Related Monthly Adjustment. All the government likes our acronyms, right? So if this situation applies to you, again, you're going to get a letter. So open your mail. Open your mail. It'll talk about it. It'll say, hey, you have a little bit extra of a penalty, or not penalty, an extra monthly Part B premium, extra Part D premium, because you're in one of these higher tax brackets. So whichever bracket you're in, that's going to determine how much you need additionally. It will also tell you if you had a life-changing event, we could maybe use a different tax year. Because what we're using is 2 years prior modified adjusted gross income. Why we're using 2 years prior? Because in January, in the beginning of the year, or in the fall when we're figuring it out, that's what we have access to. It takes the IRS a while to get all that data compiled from the most recent tax year. But you can say, you know what? This is based off when I was working full-time and I'm no longer working. Work stoppage or work reduction is a life-changing event. There's a SSA 44. It talks about it in the letter. You get that. You can get it online. Where? SSA.gov, right? Imaginary candy flying out at you for your prize. So, and the date you submit that form is the date you're going to be protected at to make that change. So if you wait 4 months, you're still on the hook for that extra 4 months of premiums, okay? It's going to change. If it takes the office a couple of months to fix it, they know what date you submitted the form, so they'll correct it with that date, but they can't go retroactive. So again, read that letter carefully. I would say work stoppage is one of the most common reasons for a life-changing event. Now, I had a guy come in one time, and he said, I won $84,000 in Vegas that year, and I don't have that $84,000 anymore. Well, winning $84,000 to me is life-changing, but it does not qualify you for a life-changing event. Because, I mean, that might be what he considered his employment, but that's not what we consider to be his employment, so it's not work stoppage or work reduction. So for 1 year, he was going to have higher premiums. The next year, if he didn't do so well at Vegas, his was going to go back down. The common situation, because I don't think that's the most common thing, though, is maybe you sell your house because you're downsizing. That's going to go into your modified adjusted gross income that tax year. So if you sold your house in 2022, you might be seeing some extra of this in 2024. But then next year, again, it's going to go back down because it was a one-time occurrence. But it's not a life-changing event where we can adjust your premium. So those are just kind of some things to be aware of. And like I said, the letter will detail all those different life-changing events for you. If you are want to apply for Medicare only, that's easy online. If you're already on Part A and you want that Part B added, You can do your special enrollment period either online now or by mailing, faxing, dropping off your forms to the local office. We need the CMS 40B, that's available online, or through your local office. That's the one that you sign that says, I'm ready for that Part B now. The CMS L564, that's the one you or your spouse's employer has to complete, verifying you've had the coverage. Just a little pro tip, when your employer hands you that form, look it over. Because if you changed companies but kept working, they probably put the date that you changed companies. So say, no. What was I overall covered by the company, not from when we changed to whatever we just did. Because they might put January of 2023 on there and you've been working, and covered for many years. So just double check that. And then, like I said, you can submit it. A little tip about faxing. If you go to our field office locator on our website, type in your zip code, the office fax number will be there. If we don't need a certified copy of something, it's a great way to submit it if you have access, because it goes right into this electronic system. It does not pile up at the office, and then management can profile it to who needs to work it. So that's nice. Medicare.gov, that's where you can go for all those questions, coverage. They have their own personal accounts. Always the .gov, us, Medicare, IRS, just make sure you're using that. SHIP counselors, like I talked about, those are who you're going to go talk to for all that extra help on anything other than enrolling in A and B. How you apply for benefits. Retirement, spouses, disability, all available on Medicare, all available online. Survivor's benefits are not available online. So if you need survivor's application or if you cannot use online services, call and you can schedule a phone appointment. Now, I understand a lot of people do like the face-to-face business, but the reality of our staffing is that Woodstock office had Greenfield, Wisconsin taking some claims. In Peru, we were taking claims for Pekin, Illinois, Bloomingdale at times, Elgin. Now we lost so many employees that Pekin and Peoria are taking our claims. So the way that we are managing to serve you better is if you're willing to do phone business, because we can have everyone in our area kind of combine efforts to deal with staffing shortages that change. But if you are absolutely unable to do phone business, someone experiencing homelessness, someone with extreme language barriers, hearing difficulties, things like that, we can schedule an in-office appointment. But it's online, then phone, then in-office is the priority level. Sure. Okay, this is our website. Now, the very top right now has, if you had an online account like I do, I've had it for years, you got a little email that says you need to update it to login.gov. That is legit. If you go to ssa.gov today, it has a little banner at the top about that. So that'll be kind of whatever's the most relevant topic. So if that's your concern, go to ssa.gov, click on that. They'll have more info for you. But otherwise, this website stays basically the same on this page, so make sure you see this. There are attorney websites. There are other websites out there. There is a website that charges you $35 to fill out a Social Security application, then sends you the application and tells you to bring it in our office. How much do you think it costs to replace a Social Security card? $0. $0. So just be on the lookout for those. They are providing a service to you, so we cannot shut them down. There are scam websites, then there's what I would still consider scams, but legal scams. So be on the lookout for that. So you should see this. You can check things out. We have a lot of great calculators. Those situations I talked about in Illinois where people don't pay into Social Security taxes, maybe they have 40 credits, but they also have a teacher's retirement pension. The windfall elimination provision, or WEP, we have a calculator for that. GPO is off a spouse with a non-covered pension, so you can figure those out. We have a life expectancy calculator, if you really want to know that. But if you're thinking about early or late, you can run that. And my favorite one is actually within the My Social Security account. It's a retirement estimator. You can go in and say, well, what if I stop working at 55? How is that going to affect my estimate? Or what if I get a new job that's paying me a lot more or less? How does that affect my estimate? because our estimate is based on the fact that we assume you're going to work and make what you did the most recent year for the next 5. So this allows you to get more specific on that. My Social Security account. How many people have a My Social Security account? This side of the room is winning, everyone. You're like the only one. Oh, she's trying to get 2 votes here.
It's been so long since.
Yeah. So everyone in this room should have one because everyone appears to be over the age of 18, right? I thought so. I'm not saying anyone looks old. I'm just saying you appear to be over the age of 18. I think it's a safe bet, right? So someone stopped by my table earlier. She's not even that old yet, but she says I'm missing earnings from maybe 15, 20 years ago. How do I get those added? You get those added by providing us a W-2. Good luck, yes. So we used to send out those paper statements to everyone. We now only send them out if you're 60 or older once a year if you do not have the online account. So if you have adult children at home and they don't have one of these accounts and they've been working 10 years, they could have earnings missing from 9 years ago and not know it. It's really important you log in once a year. That's all we do is we send an email once a year. Hey, it's time to check on that. Make sure your earnings are posted. So it's good that everyone gets one of these accounts set up. Now, one little change from this. Like I said, people with a username and password are now being told you need to go in through login.gov or you can use ID.me to update your account. If you have trouble with login.gov, we contract with login.gov, but military vets use ID.me. You can use that one if login.gov is giving you a lot of trouble. I just did it with someone in the office and they were able to get right in. So if you've never had an account though, you're going to either use login.gov or ID.me to go in there and we'll take you through login.gov. You'll get an activation code and then you'll be able to finish completing that account. So again, encourage everyone to do this. It's a really important tool. It's also good because it makes sure no one else tries to pretend to be you and go create one. So there's a lot of advantages to getting this done.
I have an interesting story. I tried to get in and realized they had my wrong date of birth.
Oh, that's a good way to find out we need to update your records too, because that's another point of those statements we used to mail. Read all of this if this is correct. This is what we have for your date of birth. This is what we have for your name. If you went by the nickname of Bubba before we updated how we do Social Security cards, you might have be Bubba on the Social Security records, and that's not your legal name. So we need to fix that because people a long time ago had much less stringent requirements. And so like a 15-year-old would go in and put their nickname on and get their card, and then they never cared again, never got another card. So that's all reasons we send those out so we can make sure before you file, ideally, that we have all our records up to date. So I'm going to skip first to if you're not on benefits. So if you have a valid driver's license or state ID, you can generally replace your Social Security card online. So if your college-age student calls you and says, Mom, I can't find my Social Security card, where'd you put it? And you know full well you gave it to them and they lost it. You say, well, go online and get it yourself, right? Because they're over 18, they gotta do it themselves anyway, but they don't have to take off work or school to go into a local office. You can just replace it right online through the online account. The only, this is for straight replacement cards. So if somebody right now is updating, citizenship status, name from marriage, divorce, things like that, that's not quite available online yet. Some states do have the marriage going, and so hopefully Illinois will come along soon enough for that too. Check the status of an application if you're filing. And like I said, get all those estimates. So retirement, disability estimates, survivor's estimates. If you're married or have children and you're worried what'll happen if something happens to me, you can see those estimates as well. Once you're on benefits, even more you can do. You can change your address, direct deposit, telephone number. Something we have now is called advanced designation of representative payee. What that means, if you become unable to take care of your own money, who's somebody you want us to reach out to first that might be able to help you with that? Now, if you have a falling out with them, don't worry. We have an interview process still if you forgot to update it. But it is something you can say, if somebody develops Alzheimer's, that's a common sign where if they can't update their information themselves, they don't remember their security questions anymore, or things like that, then that's the time we're going to look at a representative payee. Now, if they just have trouble getting around and they say, can you talk to my daughter, can you talk to my son? If they can get all through the security questions, they need a little help reading the direct deposit number or something like that, that's okay. But if they mentally can't handle that anymore, that's when we have to look into that payee. For 1099s, you can get up to 6 years prior now, and request that replacement Medicare card that you threw in the trash because you didn't know it was coming, right? So a lot of things you can do. Oh, one other thing. How many people have been asked for or helped, like a parent or relative or friend that says, I need my proof of income, or I need my award letter, they might say. You've been through that situation? They usually say, I need it for this thing I have in 2 hours, right? Yeah. So you can print that, what we call benefit verification, right online. So if they have an online account, print it right up, and it's great. So this is the statement. It's in color now if you get your online account. You'll see it this way. If you don't have an online account, you'll get it in black and white. A lot of times financial planners will ask you to bring this to appointments. So you get your online account, you will see that there. It's a PDF. If you're on your home computer, you can save it to your home computer. You can print it, do what you like with it. It's not as detailed as an earnings history as the actual online record is, but it's something, like I said, that has some nice features, and like planners and stuff will ask you to do. Oops. Fact sheets are going to be available depending on what situation you are. And if you have trouble with online accounts, someone can help you. I'm my parents' tech support, so I know how that goes. But you have to be sitting with the person you're helping. Can't be over the phone or anything. And they have to be able to answer their questions. They have to have an email address, or you can help them set up any free email address as long as they have an email address. Can't use the same email address as someone else, so your parents need each their own. Those are the only criteria. But you can't do it if you're on the phone or if you're like their attorney, something like that for them. You can also get an activation code by visiting the local office with a valid form of ID that might help you get through some of the hurdles. And finally, beware of scams. We know they're out there. They're not just phone, they're text, they're email, they're QR codes now. That's something newer I've learned about. We will not threaten you. If a valid, legit Social Security employee threatens you, ask to speak to their manager. But otherwise, that's probably not us. We don't suspend a Social Security number. They're going to say that every time. It's not a real thing. We do not partner with the DEA on operations. So your card was not found in a drug cartel's, car in Mexico. That didn't happen. And we don't require payment by cash, gift cards, wire transfers. We're never going to say send us a Visa gift card to pay for anything. So just be really on the lookout. If you get a legit scam call and you have time, you can report them online to oig.ssa.gov. They kind of try to track these things. They have had some success in catching people on the U.S. side that are then funneling the money over. So it does help. We are on all forms of social media, X or Twitter, whichever you prefer to call it. And any questions? Government pension offset, ooh, I was better over there, is when it's 2/3 of your non-covered pension. So when somebody is looking to, this is just for spouses or survivors. Government pension offsets is when you have that non-covered, like teachers' retirement, State of Chicago, whatever pension, and you're looking at your spouses or survivors benefit. If 2/3 of your government pension is more than half of your spouse's benefit, there's nothing payable. You're going to be in complete offset. If it's less, then we have to have your letter every year so we can adjust that with cost of living. Yes.
Hi, my husband passed away in 2023. I was given a Social Security amount, and I had that. Now, in January 1st, I'm going to become my status is going to be single instead of joint. Okay, will that affect my Social Security?
Not your Social Security, but if for that income-related monthly adjustment, it could change, for your, what we call IRMA. But your Social Security isn't affected by your tax status.
Okay, will that be the same until I die?
Well, your survivor's benefit, you mean?
Yeah,
Well, aside from cost of living increases, yes.
okay. Thank you.
Yes. There was one back there?
If my husband is in full benefit and I don't know, but I'm still in Social Security, if his cap is more than my full, say I wanted to take it at 63 to 64, that's not my full retirement, but his is full. If his cap is more than what I would take early, can I take his cap and not take mine until I'm in full retirement?
Not while he's living. So, yeah. Spouses' benefits have that deemed filing where you have to take your own if you have your 40 credits. Saw one here, and then I'll go back over here. Yes.
Yeah, I was just gonna go back, you said they take, 35 years of your income?
Highest 35,
Highest
yes.
income. So if you work for 25 years and you got like 10 zeros, is that lowering your cap?
If you work for how many years?
25.
Yeah, any 0 year, I mean, it's going to be,
Is it lowering your overall?
well, your estimate you'll see for Social Security is going to be relatively close in considering those zero years. If you go in your My Social Security. But yeah, any year you contribute, if you have 0 years in that, is going to bump it up. So anytime you get anything above 25, if you work another year, it's going to increase your Social Security because you're going to take away a 0 year. So that's always going to increase it. Yeah.
A lot of clients get denied for Social Security disability.
Mm-hmm.
And it seems like the trend that we have to keep reapplying.
Yeah, and don't quote me on the specific percentages, but I want to say it's close to 40% are approved the first time, 37 to 40, somewhere around there. And then the incidence percentage of people who get approved upon appeal is higher than initial claim.
And how long should that process take? Is legal something that's been studying this for a year?
Yeah. So in the state of Illinois, I would say at least 10 to 12 months for your first medical decision. Then if you have to appeal, it's another 10-ish months or so at the reconsideration and hearing. Now, our newer commissioner, one of the priorities is getting those disability processing times down. And I will say, we can't always blame it on staffing, but our disability termination service lost half of their staff during COVID. It takes 2 years to train for that job to be fully on your own. So it's difficult. You can't just hire and have them going. It's a long process. And while they're getting trained, it's taking a proficient employee who's been at their job a long time to train them as well. So that person's getting less work done. So it is a pain point. We know it's not acceptable. Another thing we're doing is we are transferring medical claims to other states' disability termination services that have less backlog. So that's sometimes Dallas region is taking ours. We're working on stuff like that to try to get those decision times down. The key, though, with any medical denial is to file that appeal within 60 days. That's very important for the purposes of back pay, for the purposes of a lot of different things. So always file those appeals. And then I think I was over here somewhere. Yes. I'm going to go back over for a little bit.
Complicated question. It's about replacement card. It's not for me. My son has a friend. They were living in Michigan. They came back, they were living with me again. Unfortunately, his friend's mother and boyfriend took all her documents, birth certificate, social security card, everything. How can he get a replacement social security card without any documentation? Because the mother won't give it.
Yeah. So how old is this person?
He's in his 40s. My
Okay.
son's 36.
Yeah. So we have to have some form of identification. If not able to get a driver's license or state ID, they can contact where they went to high school, even at 40, and ask for transcripts. Now, they can't be faxed. They need to get sent to them in the mail. But those transcripts will have their name, date of birth, school information. They'll sign them, they'll seal them, and we can use those for a form of ID. So generally, that's the easiest thing to get someone, is that school transcript.
And should we send you still sealed?
Yeah, keep it sealed, and then they can either come in or do a paper Social Security card application and put it in the mail. Yes.
He can't get a job.
Yeah, absolutely.
Yeah, and when you're appealing to one of the denied, you still do that online when you
Yes, so appeals are available online for both medical and non-medical. If someone's appealing another issue, that's available online as well. Okay, January through March is after age 65. If you did not have a special enrollment period, you have to wait for that. 3 months before your 65th birthday, the month of, and the 3 months after is your first opportunity to get onto Medicare. Yes. Yeah, go ahead.
It's a very basic question.
Uh-huh.
We have missed the first few slides. What's the difference between SSI and
Yeah, so SSI is our needs-based program. It's coming from a general trust fund, and it's based on someone's income and resources. So it's needs-based. You have to be under those thresholds. Social Security, whether it's disability, retirement, whatever, is based on earnings record. So you have to have paid into those programs, or someone does.
What if the people lost the social security numbers? They never have any education in America. So
What status are they right now?
they're retired.
I know, but what legal status are they right now?
Not their green
Well,
card.
green card. So we have to see that.
You see the green card?
Yes.
What if they don't have the
They
green card?
have to get that replaced first.
Okay, so
Yeah.
go to the USCIS, yeah.
Yes, USCIS, because if they, in that situation, we have to have that no matter what. That'll be their proof of lawful status and their ID, so we can use it for both.
So what if a person, like immigrants, they only work 10 years and they reach that full retirement age? So what about the 39 years for the work?
They'll just have more 0 years than other people.
But is that back to the,
As long as they have 10 years, you know, they have 40 credits, they can get their retirement. They'll just have a lower amount because they didn't have as many years of work overall.
so the social security also depends on how long you have been working.
Yeah, because we take the 35 highest, so if they have a lot of 0 years in there, they're going to have a lower benefit than they would have if they worked longer. But as long as they have 40 credits, they're going to be due something.
Okay, but not like full, as the 35 years.
Right, probably, you know, depending on how much they made in those 10 years. Because, you know, some people might have 35 years of very low income work and have the same monthly benefit as someone with 10 years of high income. Yeah.
See, and that's where my, because we work with a lot of
Mhm.
organizations, and that's where my question comes from, because when they show us the benefit letter, it just says social security, so if they work in America.
Yeah.
then
Yeah,
they have
at
a-
10 years, like a 40 credits.
to be able to get any benefits.
Yeah.
Yeah.
So the letter will say social security or.
Yeah.
Yes,
Yeah.
yes, yes, yes. And the
It
social
specifies.
security that doesn't make the companies to give the right
The poverty.
Yes, somebody can get both.
Yes, it is possible. So the max SSI is $943. We exclude $20 of any other type of income. So the max someone on 2 programs, both Social Security and SSI, could get is $963. So if somebody's under that $963 threshold on their Social Security, depending on their living arrangements and other things, they might be able to get SSI and Social Security. Yeah.
Okay, you know what the strange thing is? I have those people and I advise them to apply. They say, oh, no, I get enough in SNAP benefits. They will lower my SNAP benefits if I get
Yeah,
SSI, which is true.
yes.
They don't want to bother
Yeah,
me.
yeah.
So,
It's tough.
the special enrollment, I had a very bad experience this week with one of my residents. You know, it's hard to convince people to do their accounts because it's very easy
Sure.
to see everything that you want
Yeah.
to see, even the graphic with the estimate when
Yeah.
you're hired. And the question was, we called Medicare and we asked if she retired, she will reach 65 next month. But she's still working under health insurance plan, group health insurance plan. The agent said that it's better for her to retire as soon as possible, even if she's working and getting insurance, which I was not convinced with, but that was the agent. And when you
Someone at Social Security said that?
Yes, a Medicare actually.
Oh.
They're part of Social Security, but we call the Medicare number.
Medicare, or like an agent, like
No,
a.
Medicare.
Oh, okay.
Yeah, the official Medicare. So that's what he said. And he said, you will receive the card in the mail, then you have to go back to Social Security, deny or
Part B.
delay the Part B and just get the Part A. I asked the question, she doesn't want to pay those $174.
Yeah.
Which-
And you can do that, but you don't
but
have to take the
she
Part
doesn't
A.
want to make it complicated, so that's okay for
Yep,
her. It's
that's
like,
absolutely
it
fine.
works.
In fact, people with a health savings account definitely don't want to take the Part A because it affects health savings accounts if you have any
Yeah.
part of Medicare. So we have a lot of people that do withhold both.
Yeah, so that, thank you so much
Yeah,
for explaining
sure.
that. So I'll advise her to meet with Chip Counselor though.
I'm out of cards, but I forgot to pack more. I'll be right back. Okay, I'm going to get him.